thank you all for coming. It seems just no time at all since we stood here in a little bit more of a chaotic room. It felt quite ordered this evening. I think a year ago people didn't really know what to make of us, and I think the way we've landed this evening is probably a little bit resembling what the years felt like. We all came crashing in and put our hands up with this wonderful vision of a happier and healthier bailiwick where everybody felt connected to support that mattered to them. And it was just a bit like, that's such a bold vision, how can we make that work? And over the year we've just put a little bit of order on that grand vision, which has been fantastic, and that's thanks to the work of the board, the scrutiny when I went and did the strategic review, the fine detail of the business plan, and every detail accounted for. Thank you, Catherine, financially. Over the last year we've raised over £500,000, which is all accounted for. We now employ 7 people, and it just feels very serious all of a sudden. And we're delighted to have you, Heidi, on the front, and we appreciate the support and the partnership that we have from and with HSC. And Mark Degari, who's Director of People, emailed me this morning and said he wished he were here because he really does appreciate what we do and fully supports what we do and is very excited about how we're going to be a partner with purpose in the future. So I've just got 20 minutes to run through a real snapshot of what we've been up to, and none of it really reflects the real slog of the team. I mean, the work, the 13-hour shifts, Debbie and I sat at a screen working out detail, funding application after funding application, success after success, and any failure that we've had, it's just been a real opportunity to learn from. And so now we feel like we're a real growing up charity. So thank you for all being part of the journey, because it feels like the beginning of a very exciting journey. With that, I've probably taken up way too much time already. So I've got to, this is my dear friend Arabella. Arabella, where are you? Skulking at the back. We nabbed this picture off Locate Guernsey. Arabella and I met when our 17-year-olds were toddlers, and we've been friends ever since. And I'm delighted to say that Mary Perkins and Specsavers are now paying for her to keep our website, our directory, up to date and trusted with 10 hours of support from Arabella a week. So thank you, Arabella, for coming on board and for allowing us to use your picture on our beautifully branded work by Ben from Refresh, who's in the room. So these are really what we've been focusing on. And I think when we look at the amount of people that we've partnered with on the very end slide, you'll see that people have really put their hands up like we asked them to at the beginning of the journey. It's definitely a very specific, measurable, I would like to think, achievable and realistic, very time-bound plan. We published our business plan, which is from 2019 to 2021. And I can't underestimate the commitment from the rest of us, the staff and the volunteers who show up all the time. But what we really want to be is a trusted brand. We don't want to be a flaky, happier and healthier charity. We want to be a really trusted brand that people can rely on, to be connected to support that matters to them. And that's ultimately what our bold vision is about. There's our very bold vision, and you'll notice that we don't say happy because that's somewhere under a rainbow, and you know that we don't say healthy because who's really healthy and who can ever be really healthy? What we hope to be and what we aim to be is just happier and healthier, but also, and I'm delighted to see Karen Leach there in the room, who talks about meaning and purpose. And that's that last bit that HSC are so, and their community work are so all over as well, thanks to Karen. And Lottie sat there beside her. These guys, the only thing that's really wrong with our board is we don't have enough older people. We're all a bit 250-something. But it means that we juggle really, really busy day jobs and teenagers and young children, and in Louise's case, a whole college full of them. When we invited Steve from Guernsey Water onto the board, I sat down with him, and after he told me that Longley meant long man, I said to him, what's water got to do with health and happiness? What's your place on the board? And he reminded us that we're all 75% water, so he was allowed on board. As a result, the scrutiny from the board, I'm a very strong character, anybody that knows me, and it's just wonderful to have a board that believes in me and is an enabling board, but at the same time, nothing is bulldozed past this board. And so I'm really proud to be working with them. This business plan has been the bane of my life, and I'm so proud of it. And a shorter version of it can be found on our website. It's our plan for the next 3 years. And the innovative sort of, in a nutshell, of what we do, directory to doorstep, did come to me when I was running one day through the Talbot Valley. I thought, Health Information Guernsey, our predecessor, did this wonderful voluntary car service, and we need to keep that because it works, but what else can we wrap around that? And so the doorstep is what our wonderful drivers in the middle table do. They pick people up at the doorstep and they take people to that support, and they get to know them, and they give these people a wonderful day out, which is so meaningful to them. And this is what we do. We tell people about the support in the community, and it's just been a joy, and that's why I've made it my business tonight to meet and greet all of you that I could possibly get around, because all of you provide the support in the community that matters to people. You're the assets in the community, and if people can be connected to the great work that you do, we call you our directory partners, we feel that they have a better chance of living a happier, healthier and more fulfilling life. And then we help people decide what matters to them. There's any number of fancy words around our model here. When we're telling people, these are our community connectors. They have a 2-hour signposting training. And they're a whole network of community connectors that signpost people to the support that matters to them. And then the people that help people decide what actually matters to them, they're called health connectors or link workers or advocacy workers. But ultimately, they have a deeper dive quietly with the person to find out what matters to them. And then if they're isolated and have unmet transport needs, we actually take them there. So what's been the impact of this model? Who has done it, perhaps, is a better place to start. Anyone that's done a structure and tries to be a flat structure like I do, a coach. We don't like hierarchies. We don't like to manage and control people. We like to enable people. We like that asset-based community development approach. But this is what we end up with. 7 staff. It's not for me at this point to talk you through who's paid and who's not paid. But below the time bank are volunteers, and we believe that these volunteers need to get something back, which is why we're all about putting all of our volunteering hours through this time bank, because I said a year ago that the success of our mission really comes down to who puts their hands up, and actually we're all really busy. And so we're only going to put our hands up sometimes if we can get something back for our time. So whilst I'm driving you to the support that matters to you, somebody else is perhaps doing my gardening for me. The whole proposal for time banking can be found online. You'll remember Health Information Guernsey was at one point had iteration as a health exchange, and I'm really proud to say that we keep up that health exchange thanks to Kerry sitting over there, always keeps this stocked. These are what we call health exchanges, places that pop up with information that matters to people. But this is the real nugget, and thank you, Mary, for this when I met you in a canteen about 18 months ago. And Mary said, "What do you need?" And I said, 25,000. It was in our bank account a couple of days later, and with that 25,000 we mapped the assets in the community, and now they are on our online directory. So thank you, Mary, for that. Thank you for believing in us. So we now have 293 directory partners. And so each one of these little bubbles is a partner. Each one of these is a charity or a statutory service or a group or an activity that will enable somebody to live a happier, healthier, more fulfilling life. So you can imagine Guernsey Mind. I can see we've got Arts for Impact in the room, we've got Men's Shed in the room, we've got Alzheimer's Society in the room. You know, you're all dotted around. Each of you do the wonderful work of supporting people in the community. So we just need people to get access to you. So one button away on our directory, you're there. Some fantastic stats, and thank you, Ben, again, for keeping an eye on who's looking after us and out for us, and who are we reaching. And we're really, really impressed with the analytics that have come out on the back of our website there. These are the wonderful community connectors. 56 of them, I think it is. Yeah, brilliant. 56 of you out there already. Our KPI is to produce 100 people who are community connectors a year. Debbie, do you want to just stand up and wave? And this is your trainer over here. Debbie has 10 years working with people in health, more. It goes back 25 years. But Debbie, the results of the feedback from Debbie's training is extraordinary. People are loving their 2-hour training to be that community connector. And as I said, the next bit then in the middle is, once they know what's at them, help people to decide what matters to them. We have 3 health connectors providing one-to-one support and advocacy, and we, in fact, our college here, the College of FE, trained, which we got the funding for this year, 11 people on Ireland to have advocacy skills this year. But we didn't keep the 11 people to ourselves. We have 5 of our team trained as advocacy workers. But Guernsey Mind took a few of the free training places, and Carers Guernsey did, and Fiona did here at the Coatills, and Linda, the chaplain at the hospital, also trained as an advocacy worker. And our really exciting new project is to partner with HSC for the next 3 years to do a pilot social prescribing project where we will have 3 link workers sitting down with people and helping them to decide what matters to them. And Jim's in the room, so thank you, Jim, for believing in Health Connections and funding us, and thank you, HSC, for deciding that actually the infrastructure that we'd already created in terms of what's out there, help people decide what matters to them, and take them there was the perfect place for the Island Social Prescribing Project to sit. So Melissa Mitchell, who worked at Styx and created the wonderful programme there for the last year, will create that social prescribing programme in 2 other locations on Guernsey for increased equity, and also hopefully in Alderney if we can get the funding for the Alderney one. This staggers me, but it doesn't surprise me because I see how hard people have worked at Health Connections this year. And if this continues to grow in this way, then we're looking at obviously an awful lot of unmet need out there starting to feel like it's being met, but it's quite worrying in some respects that there are this many people coming to us for support. Wonderful, but you can see how we will need to be supported by the broader community to remain sustainable. Kerry's in the room. Kerry, are you able to stand up for a second? There's Kerry. Kerry does all of our off-island support. We have a SLA with, and always have done, Hague, our predecessor, Health Information Guernsey, for the last 20 years has had an SLA with HSC. Only 23,000 a year, but all the same, with that money, we can make sure that everybody going off-island for treatment and care, when they are at their most vulnerable, can come and talk to Kerry. Kerry has trained as an advocacy worker, probably has one of the best communication skills I've ever met naturally. And Kerry can sit with people and their families and give them an information pack and one-to-one support, which is that care and compassion piece that perhaps their doctor referring them off island doesn't have time to do. And we have Sheila in the room. Sheila, are you able to stand up at this point? Sheila is our voluntary car service coordinator. Sheila coordinates now 19 volunteer car drivers. We have some drivers in the room. There's some new drivers in the room, so you don't need to stand up, and some drivers that have been with Health Information Guernsey for many years. And these drivers are lifelines for the most isolated in our community. So there are people in our community who have unmet transport needs, which means they live too far down a lane to get on a bus. They can't afford a regular taxi. And they don't have friends or family that are available when they need to get to an appointment that matters to them. But what we're really interested in doing with this voluntary community transport service is ensuring that everybody is who needs to be is enabled to access opportunities for social connection, health and well-being. Because in the past, this voluntary transport service took people to medical appointments only. And what we're now knowing is that there is clear stats, which Sir Sam Everington talked about when he came over from Bromley by Bow and talked about social prescribing this year, that what we do to help ourselves is 75% more impactful than what the doctor will tell us to do, which is only 30%. So it's all about people deciding what matters to them in the community, whether that's to go for a choir singing at sticks or a qigong class that helps your balance, prevents your falls. Singing, of course, helps respiratory. But it goes on and on. I can see we've got Helen in the room and the wonderful work that Arts for Impact and Arts on Prescription are doing to help people. But this was just, and so we take people to the support that matters to them, not just the doctor's appointment. And when they go to the doctor's appointment, what is lovely is that they might decide to go to the pharmacy or go to the shop or go to the hairdresser or visit a person, a relative down a lane on the way home. These are all the things that make them feel happier and healthier and that matter to people. This was such fun, and I apologise, there's Dave Ingalls from Age Concern in the room. He was coming, that's Dave on the far left. This was a coaching process which I did in St John's Community Hall. It took it was over several months, but we've got Carers Guernsey here. You can see you've got Guernsey Disability Alliance. I can see we've got some of our colleagues here in the room. They're actually all holding a word. I asked them to give me a word that they thought their members needed in terms of transport. And so it was a very long these words were going to make up the mission statement of our voluntary community transport service, and we got 25 words. We lay them all out on the wall, and we had HSC business manager there at the time as well. She thought this was such an odd way to co-create a business plan, but what it meant was they looked at the 25 words and it was far too many words to make a mission statement, so they pulled out words that they didn't think meant so much. And what really they came up with was a co-creation of a mission statement for a transport service that everybody could use, that would matter to all their members. Social connection was important, enabling access for all. You could see the grains of people's values coming through, and so that's what they ended up with, enabling access to opportunities for social connection, health and well-being. And it's lovely now because all of those people will refer their members, as well as people being able to self-refer to our transport service. We're all into what volunteer value is at the minute, and this is if we paid our volunteer drivers £8.40, which is just over the minimum wage, or under the minimum wage for an adult, we would be paying somebody a very hefty wage to drive around the island all the time. This is how many journeys we've done this year to date, and these are the end of Q3 is the end of September, and I can tell you the phone doesn't stop ringing in the office. So 5 to 8 new referrals a week, and Sheila will regularly email me and say, we can't take any more. I'm very grateful to at least one new driver I can see in the room today. The social prescribing project isn't I don't want to talk more about that, but it's extremely exciting that there will be these programs, and I would like to think that going forward, the kite mark for social prescribing will be easily accessible under the things on our directory where you can actually prescribe you can encourage a link worker to encourage you to go there, or you can tell your doctor that that's what you'd like to do instead of taking too many meds. Now, I love the shop, and Ivana, do you want to stand up? Ivana's our shop manager. Ivana's from Prague. She was here at our launch. Ivana has to ban me from the shop because I just love the shop. It's where I go to play and, you know, just love it. But we've done some really interesting things in the shop this year. Linda, by the way, in that last picture was the midwife who looked after me 17 years ago when I had my first baby here. Volunteers fighting over the price of things, everybody in the high street and the bridge saying everything's too expensive, so I come along and take the price off everything. And that's what happens. So it's just great when you're innovative. And the reason I did it was to stop the fight, stop the gossip, and basically to ensure that everybody had access to the stuff that mattered to them, that made them live a healthier, happier, more fulfilling life. I hope you got that picture, Ollie, because I won't do that again. Now, what's also lovely about our charity shop is that we're an outlet for other charities to sell their stuff. So Creative Learning in Prisons have got their stuff there. And the new young gardener's come along and he's put all his plants in the shop to make it green and fresh. And this collage in the back was facilitated and made in the Guernsey Cheshire home by Helen Bonner Morgan, who facilitated it. And Dave Waugh, who's also in the room, bought the collage from the Cheshire homes, donated it to ours. It's off the bridge, put it in our shop in the window in the bridge, which give people a sense of pride and belonging, being in the bridge, but also the money that Dave used to buy this has gone back into Cheshire homes for them to be able to run another arts programme for their residents. And Louise is just trying to get my attention. So here we are. One of the volunteers said we need a comments book, and that last one was what, there were many, many wonderful comments in the charity shop book, but everybody was delighted with our new innovations. But this is from our actual service. We cannot believe that 99% found our service very good or excellent. So I've been a little bit like, well, I don't know how to describe myself this year, but I've been banging doors down for money. And so the next doors I'm going to be banging down is for the time bank broker's salary, because I'm utterly convinced, because of the stats that have come from Time Banking UK, that this is what's really going to help us to increase our social capital on Guernsey and enable us to really live a healthier, happier and more fulfilling life. Why us? Because time banking ensures that people are connected to support, the practical nitty-gritty support that matters to them. But this is the incentive. When we're time poor, they can get an hour's credit. And everybody is a contributor. And this is the bit we love. We don't really like the fact that the ageing demographic is seen as a burden on the community. We don't believe it. We don't see it from our drivers, who many of them are over 75. And we know that everybody, even those isolated from the comfort of their own homes, can be a contributor. Somebody asked me today what the legal support would be. Well, that would be a law firm putting in 10 hours for legal aid for living wills, which really stress older people out. But the older person who's at home can give a history lesson, a reading lesson, a piano lesson, or play Scrabble with somebody, all from the comfort of their own home. And at the same time, they're earning those 3 or 4 hours of credit. And somebody comes in and does their gardening, their housekeeping, their household maintenance, cleaning their gutters, and all of a sudden they are living independently in the community for longer, which I believe is what you'd like, Heidi. So we've been delighted to put our hands up and be a partner, not of purpose, but with purpose. And we couldn't have done that without all of the people that have supported us and put their hands up. I can't possibly stop that from jiggling. So I'm not going to, but what I'm going to do now is ignore that and thank Louise for being patient with me and not scowling too much, because I have gone over by just a minute. But thank you all very much for taking the time to listen to us. Can we please put our hands together for the board who've worked tirelessly, the team who've worked tirelessly, and our army of volunteers who've worked tirelessly, and all our directory partners who've owned their pages, reclaimed their pages, and update the community with all the support that they offer on a regular basis. So if anyone believes in a joined up, stronger community where everybody's connected to support that matters to them and believes in the difference that every single person on the island can make, no matter their age or condition, then you should have a clap now.